好，首先歡迎大
Welcome to the Mr. Press section. Today we have Secretary for Civil Servant, Mr. Patrick Nip, and Secretary for Food and Health, Dr. Sophia Chen, to give us an update on the vaccination program. Mr. Nip will speak first, followed by Sophia Chen. Then we'll take your questions. Secretary, please.
各位
Members of the public, friends of the press, good afternoon. Ever since the COVID-19 vaccination program started on Friday, the 26th of February, this is the fourth day. And in the past 3 days, over 20,000 people have already received their first dose of Sinovac vaccine. As for the online booking system, it was reopened at 9 a.m. this morning. For those who belong to the 5 priority groups, they can go onto this online system and they can make reservation at 8 Sinovac vaccination centers and also the 18 general outpatient clinics under the HA. And they can make a booking until the 28th of March. We have a quota of about 270,000. Today, the system works very smoothly. People's response is still very enthusiastic. Though people may have to wait for some time for the online reservation, however, when it comes to the performance of the system, it's very stable. And many people have made reservations successfully. Up to 2 p.m., over 150,000 people have already successfully made their booking. And the Department of Health, from today onwards, will, on 3 days, distribute the first batch of Sinovac vaccines to private doctors and clinics who have joined the COVID-19 vaccination program. And people can start going to these private doctors and clinics for the Sinovac vaccines from today, Tuesday onwards. Up to now, about 830 private practitioners and clinics have reserved vaccines with the Department of Health. About 63,000 doses have been reserved to them. We will after sending the first batch to these doctors and clinics, we will look at the speed of the progress of vaccination, and we will look at the needs, more supplies can be provided to them. In other words, as long as there are still priority groups, people who would like to go to private doctors and clinics for vaccination, we will provide the vaccines to them. For the people who take the jabs at the private clinics and doctors is for free, just like in the community vaccination centers. As for the list of doctors and clinics, you can find the information on the relevant websites and also on our COVID-19 dashboard, and also on our interactive map on the epidemic information. You can find the relevant vaccination centers. They include community vaccination centers, general outpatient clinics under the HA, and private practitioners and clinics addresses. As for BioNTech vaccinations, from the 3rd of March, Wednesday onwards, we will open the online reservation system so that people can make the booking at 7 community vaccination centers under the HA. And they can reserve their time slots from the 10th of March to the 28th of March. The quota exceeds 140,000. As for the 7 BioNTech vaccination centers, they are Sun Yat-sen Memorial Park Sports Center, Sai Wan Ho Sports Center, Hill Kwong Street Sports Center, Kwun Tong, Education Bureau, Kowloon Tong Education Services Center, Lai Chi Kok Park Sports Center, Long Sum Avenue Sports Center in Shangshui, and Yuen Long Sports Center. Well, just like the Sinovac vaccination centers, these 7 centers will be open officially to the public on the 10th of March, and before that, vaccination will be provided to some members of priority groups. On the 6th, that is Saturday, this month, and up to the 9th of March, we will make arrangements so that MA healthcare personnel and other members of priority groups can take jabs at such centers. And the centers will be operating in small scale in the first phase. And we will also provide vaccinations to MA staff first, and then later on we can ensure a better operation. So this is about the Sinovac vaccination centers and BioNTech vaccination centers and the relevant arrangements. I would like to stress again, the government has purchased enough quantity of vaccines so that Hong Kong people can take their vaccinations. And we will look at the supply of the vaccines. We will roll out the vaccination programs in a safe and orderly manner. And we will also learn from the operating experience. We will try to speed up the whole process as soon as possible. And I would like to reiterate, under the present pandemic, taking or receiving the vaccination is better than not receiving vaccination, and doing it earlier is better than doing it later. Now, with this vaccination programs, no matter whether it's Sinovac or BioNTech, they are all safe and up to standard.
Secretary for Food and Health. Good afternoon, members of the public and fans of the media. The government COVID-19 vaccination program online booking system is reopened today. As you heard from Secretary Nip, the system is generally running quite smoothly, and I'm glad that there's a very good response from the public. In fact, from 22nd of February, there is now over 20,000 individuals immunized with the Sinovac vaccine first dose. As for the members of the public who experience some discomfort following immunization, for one individual who reported heart palpitation following vaccination, from what we know, he's now in a stable condition. The Department of Health and the hospital authority colleagues are following up. On vaccine safety, this we place the utmost importance. The Comirnaty vaccine has arrived in Hong Kong last Saturday. This vaccine was also subjected to the advisory panel deliberation on its clinical research data, overseas approval situation, and other data on safety, efficacy, and quality, which led to the government approval for emergency use. Even though, according to the clinical data, the Comirnaty vaccine might lead to more likely reactions, for example, injection site pain, headache, muscle pain, fever, or joint pains. These are mild or common side effects. However, I appeal to the public to support this vaccination program and get immunized as soon as possible, as it can provide a certain degree of protection from infection. I should stress again, for the two COVID-19 vaccines arrived in Hong Kong, they have been vetted by experts as safe, effective, and quality assured. The benefits of immunization outweigh the risk. The efficacy of the two vaccines have exceeded the 50% efficacy threshold set by the World Health Organization. According to the U.S. Center for Disease Control and Prevention data, the efficacy rate for the ordinary flu vaccine is around 40 to 60%. After immunization, the monitoring of the side effects and its mechanism is important. Besides, at our vaccination centers, or the 30-minute observation following immunization, to align with the role of the vaccination program, the Department of Health has initiated the monitoring of the adverse events following immunization, AEFI, including strengthening the existing routine surveillance and proactive surveillance. The Department of Health current pharmaceutical safety surveillance system has been reporting and analyzing the reports filed by healthcare professionals and pharmaceutical industry, and on the relevant AFI, especially serious AFIs data, to conduct a causal analysis in determining whether these incidents are related to immunizations. The Department of Health had drafted the vaccination fact sheet for Comirnaty and CoronaVac. You can also find them online. The fact sheet carefully detailedly lists out the possible anticipated side effects following immunization and situations which you should seek a medical opinion. The Department of Health should also make reference to the recommended strategy by WHO on COVID-19 vaccine surveillance, including strengthening the routine surveillance and proactive surveillance. Such measures include 3 aspects. First, we already set up the online reporting system to report on vaccination adverse events for healthcare professionals and pharmaceutical industry to report on such AEFIs. And second, we have written to healthcare staff and the organizations encouraging them to proactively report serious or rare AEFIs. Third, on proactive monitoring, the Department of Health is partnering up with Hong Kong U to actively collect data on possible adverse events. For example, list of special events of special interest and unexpected adverse events, for example, on Guillain-Barré syndrome and acute disseminated encephalomyelitis from the public and private healthcare institutions, where we shall conduct causal analysis, and we'll also conduct a full surveillance on targeted groups on possible common adverse events following immunization. The government has also set up an expert committee on clinical events assessment to conduct continuous surveillance on the possible clinical events following immunization, as well as providing professional opinion and suggestions on the safety monitoring of vaccines. When Department of Health receive the reporting on serious adverse events, we shall follow and liaise with the relevant healthcare institutions, for example, hospital authority or healthcare professionals, and shall follow the existing mechanism in referring the report to the expert committee for assessment. As you recall, and just last Friday, the Finance Committee of LegCo had approved a $1 billion funding to set up an indemnity fund for adverse events following immunization with COVID-19 vaccines. I would like to thank the LegCo members for approving these funding applications and allowing us to activate this fund early. Finally, I must stress again, safe and effective COVID-19 vaccine can provide a certain degree of protection from infection. Which also minimize the virus damage to our health in protecting our lives and health, and also an important measure in protecting our local healthcare system, and also our society hopes in gradually backing on its feet. I hope that you can enthusiastically supporting this vaccination program to protect yourself and others. Thank you.
Thank you, Professor Chen. Now it's question time. So after raising your hands and after getting your microphone, please tell us which institution you're representing and tell us your name. Please hand over the microphone. I'm from Mingpao. I want to ask about side effects. So up to now, you have received only one case, that is a person has been suffering from heart palpitation after taking the jab. And how about other cases? And also, I want to ask about this palpitation case. Now, after 2 days, the person is still hospitalized. Why is that? And have you handed over the case to the experts for assessment? Is it related to vaccination? And can this person make a claim to the indemnity fund? Earlier on, Mr. Nip mentioned this. Well, over 1,000 private doctors were joining this program, but now you are telling us there are only about 830 of them. So some private doctors pulled out in the last minute. Why is that? And also, I would like to ask about today's vaccination. We've heard the responses of some people. Well, we've heard from some elderlies. They don't know how to make a reservation online, so they want to go. So they went to a post station, and the elderly wants to register for two companions. But the post office asked the two companions to be present as well. But the two companions have to go to work. Well, if you make a reservation online, you don't have to appear in person, right? So why do you have to do that at the post office? I'll answer the first and last questions. Last questions first. About what you said, that is, an elderly person went to a post office, and the post office officer asked the companies to go to the post office in person. Now, if that two persons want to make a reservation in such a way, the relevant information should be provided at the post office so that the information can be input into the system. Thank you for your question. We will follow up. And also for private doctors, well, if they take part in this program, we haven't set a quota for the number. Now, for private doctors, if they want to take part in the program, we would welcome them. Earlier on, over 1,000 private practitioners said that they wanted to take part in the vaccination program. Today, we have uploaded a list of 830 doctors online. These doctors have reserved vaccines with the Department of Health. Well, some doctors want to join the program, but they have not reserved vaccines or ordered vaccines from the DH yet. So for these doctors, if later on they order vaccines from the DH will make the relevant arrangements. So for the first batch of vaccines is already been sent out today, and some doctors said that they have already received the vaccines. So at the earliest, vaccinations in private clinic can be done. And if they want further supply later, as long as there is such a need, will work accordingly. And your question is about side effects after vaccination. Now, for all our vaccination centers, well, including the 18 outpatient clinics under the HA, now, if they receive a Sinovac jab, they have to wait there for 30 minutes for observation. We'll try to find out whether there are any problems within that 30 minutes, and after 30 minutes, they can leave. So for that 30 minutes, at the vaccination centers, we have doctors and nurses, so they would be handling the patients if any problem happens. So if there's any problem, the doctors and nurses would make an assessment. Would observation had to be carried out longer, or should the patient be sent to a hospital? So, and if a patient is sent to hospital, I mean HA hospitals, well, you mentioned a case just now that is about palpitation. Well, for that case, the patient is in a stable condition. As to whether he will have to be hospitalized for a longer time, we will have to look at the actual situation. Maybe he has some chronic diseases, and maybe he's suffering from other health conditions. So all these may be related. We do not have the most updated information yet. I believe that the HA will be very clear about such cases. As for this type of cases, as to whether they should be considered as adverse events following immunizations, and whether there's a causality effect with the immunization, the Department of Health and the expert committee will be making assessments. And afterwards, they will decide whether this would be an indemnity fund case. So there is a whole process to follow. Well, we have already set up the indemnity fund. It's there, but we don't really want people to, we really don't hope people need to use it. So after taking a jab, if a person doesn't feel well, he or she will be sent to hospital accordingly. Otherwise, we also want the people to monitor their own condition very carefully after immunization. If there's any problem, they should go to a doctor.
Yes, this individual was sent to hospital following immunization. We will encounter similar situations and we will announce the latest details as they come through. And the reporting in light brown. Commercial radio. Besides the hospitalized case need to be reported for other minor incidents, or do they need to be reported as well? And what will the number of cases need to be reported, and will the numbers within the range of government expectations? And on the immunization progress, we described as satisfactory. And based on the previous estimate, will the general public able to get vaccinated in the second quarter, or have you adjusted a timetable or any room for such adjustment? If we want to make a booking, the website may load very slowly, or the system may overload. When people need to get their second dose, or any duplications, can the vaccination centers cope with such demand? A question for Professor Sylvia Chen. Would you see that the pandemic situation as fluctuating? Some restaurant customers could not be located. It has been reported that inaccurate information has been provided. Would you strengthen the tracing of close contacts? I will speak first on the two questions. First, on the progress of vaccination. That at the start of the vaccination program, we hope that it will be safe and smooth and orderly. Whether for Sinovac vaccine or for the upcoming Comirnaty vaccine, at the vaccination centers, we will open first. We also make some prior arrangements for the priority groups to get immunization, which allows us to be familiar with the process. At these vaccination centers, as these are 2-dose vaccine, at the beginning, the booking quotas will not be ramped up to the maximum capacity. I need to reserve some capacity or quotas so that when these priority groups start to receive the second dose, they will also take up some quotas. We will still have some remaining quotas for the public wishing to take the first dose. That's why how we roll out. And looking at the response, we see as quite enthusiastic. The public wish to get vaccinated. In our rollout, we shall do our utmost, and subject to the operation experience, we can further enhance the whole workflow, and where possible to expedite the vaccination progress. At the same time, we have to ensure that our vaccination is safe and orderly, and especially the observation after vaccination, we shall look out for any possible reactions requiring the healthcare staff to follow up. So another question on the booking system. When we open the system today, I will see that the system has been performing quite stable. Why is it quite slow? As there are a large number of people doing the bookings, I would say that which led to the long queuing time. From now till 2 p.m., we have over 100,000 people successfully made their bookings. I believe we'll continue to monitor and to further enhance the system. For the second dose, when they book their first dose, they already make the booking for the second dose at the same time. As for the slight problems following vaccinations, there are 30-minute observation at the vaccination center. They will be subject to monitoring or surveillance by the healthcare staff. And for some minor problems, they will be taken care of by their staff on site. If they need to be taken to the hospital, we will also report such figures to the public. We shall update our figures every day. A quick answer on the pandemic situation. We can see the K11 Musea cluster is quite worrying. The Center for Health Protection has acted swiftly in putting the close contact to quarantine, while some other individuals have been arranged to get tested. Where the restaurant is concerned, is already closed. The whole K11 museum is now closed for cleansing. The overall situation, we notice there are more people going out for meals. We'll strengthen up the tracing and try to understand the scenarios, their hygiene levels of this particular restaurant. This later afternoon, Professor Yun shall team up with the FHD and the CHP to do a site visit and also offer his recommendations. I would like to appeal to the public that during they should spread out their meal hours, and if also they should have meals on their own. Well, under the new normal, especially the pandemic is fluctuating, they hope that we can all cooperate. Next question. In the second row in the middle. Hong Kong Economic Times. So when will we use up the first Sinovac shipment? When will the second shipment of Sinovac arrive? Professor Chen mentioned that the case with heart palpitation. Yesterday at Yunbo Road Sports Center, there was an elder lady being hospitalized. Have you received this report? Would you refer to the expert committee to see whether it's related to immunization? Just now you mentioned about the K11 Museum cluster. As more cases is now reported, the expert mentioned it might have to do with the lag in testing. The catering sector mentioned they waited more than a week for the results to come back. Well, the secretary, are you aware of this and found out the reasons? And last question. Recently, we see a rebound in number of cases. Would you see any need to tighten these measures?
Well, for the Sinovac vaccination, we have received 1 million doses. And now we have rolled out the vaccination plan in an orderly manner. You know about the figures very well. As to when will all the vaccines be used up, I cannot make guess now, but you can monitor the progress of the vaccination. And secondly, we will talk to the provider. We will keep a close contact with them. And in due course, we will arrange for the second batch of vaccines to be shipped to Hong Kong. So we would not interrupt our vaccination programs. And after vaccination, at the vaccination centers, the people vaccinated have to wait there for 30 minutes for observation, and medical staff will be monitoring them. I have visited such centers. I have talked to the people there. Well, some people would sit there and close their eyes, and I would ask them how they feel. They say that maybe they feel dizzy, and they would be arranged to go to sick bays for further checkups. Now, some of them might not have taken their breakfast, and as a result, they feel dizzy. So these may not be all related to the vaccination, but we are paying very close attention to them. And to play safe for more serious cases, the relevant people will be sent to hospitals. So when it comes to the dissemination of information, we hope that we can provide you with more thorough information. That is, within a certain period of time, how many such cases are found at vaccination centers and how many people are sent to hospitals. So we will be giving you the relevant figures. So for all the people who are sent to hospitals, not all of them have problems related to vaccinations. So we have to look at these cases on a case-by-case basis. But we will provide you with the relevant information and figures. I'm sure the HA will be looking at each case very carefully, and they will monitor the case in a prudent manner. Well, I would like to answer your questions. Just now, Mr. Nip has told you that the booking system has been reopened, and as early as tomorrow, private doctors can start giving jabs to patients, and there are many locations where people can do that. And also, we will be adding some vaccination centers, so there will be a lot of places where you can get your Sinovac jabs. The response has been very well in the community, and now over 100,000 people have already made their booking. And also, people can make arrangements with their own private doctors, and I'm sure there will be a significant number of people doing that. As for your question about testing, we are very concerned about that. Well, we have seen some delays in releasing test results. So we have been talking to the testing operators. The HA has also done a lot of work. Now, if there are delays, the contractors will be contacted, and they have promised that they will do the test as soon as possible, and new samples will not be sent to them. Those samples will be distributed to other contractors because we want the work to be done as soon as possible. And after the Chinese New Year, we have added one new requirement. That is for the premises who are going to reopen their businesses, the staff would have to undergo such a test. We give them a period of 14 days, but people want to do it as soon as possible. So that's why there were so many people trying to take their test in a short time. Now different contractors are sharing the workload. As for the epidemic situation, yes, now we've seen this K11 Musea cluster, and it seems that the epidemic has rebounded, but we have implemented new measures and requirements. And if any problem occurs, we hope that the risk can be minimized. For example, we are encouraging people to use the Leave Home Safe app. This is to help people, and if you all can use the app, then you can help us by tracing the relevant people. If you just leave your contact number, there may be mistakes, so it may be quite difficult to track the possible contacts. This is not desirable. So I call on you to use the Leave Home Safe app and to do tests. For restaurants, if they do not comply with anti-epidemic measures, for example, if the staff do not wash their hands, or they do not wear a face mask, or if the distance among tables is not sufficient, or they do not have a customer or capacity of 50%, then there are measures to stop this. For example, we would ask them not to serve during dinner hours for 3, 5, or 7 days. So when it comes to law enforcement, I'm sure we need to be more stringent. So we have such measures, and if we see risks, we will try to minimize such risks through such measures. Last question. I'm from HK01. Just now we talked about 2 cases in which people have to be sent to hospital. So has the expert committee held a meeting? What conclusions do they have? And if they haven't had a meeting, do you think that people will be worried about the vaccination program? We asked the HA about these 2 cases yesterday. However, we haven't received an answer from the HA. Now, for cases like this, whom should we contact? And early on, the Department of Health said that in mid-March, they would give us a report on the AEFI. So how about before mid-March? And earlier on, the new permanent secretary of FHB has been criticized. So can you give us some comments on that? Well, first about vaccination. When it comes to dissemination of information, well, in the future, every evening we will be publishing a press release. That is how many people have been vaccinated and the cumulative number of people vaccinated. And also, we will be looking at the past 24 hours before midnight, and then we will tell you how many people have to be sent to hospitals after vaccination. As for the progress of each case, I think the HA will respond to your inquiries in accordance with the established mechanism. As for the expert committee, when after the vaccination program started, they have been monitoring the AEFIs. And every 2 weeks, they will have a summary, and they will tell you about the cases in the past 2 weeks. If there have been serious cases, they would report to the public. immediately, and there will also be follow-up work. So we already have all these mechanisms in place.
關疫苗接種
Just now we talk about vaccination. I noticed that the past few days there is a directorate civil servants and acting in a higher capacity, which led to public concern and different opinions. I would like to make a response here. The promotion of civil servant is following an existing mechanism and preset rules, and these rules are set by the civil service regulations, including the character, competence, experience, and the qualifications required, and also recommended by a selection board to fill a higher position. And for the civil service above the master pay scale, point 26 on the recruitment at the promotion of civil service must be referred to the Civil Service Commission for recommendations. And announcing these directorate appointments, the Civil Service Bureau will also give an assessment on the appointment. The basic law stipulated that the Hong Kong SAR political system in which the civil service is an important component. The CSB has regretted that for those who joined the Hong Kong government after 1st of July last year to take an oath or sign a declaration to espouse the basic law and uphold the basic law and be responsible to the Hong Kong government. And for those appointed to senior offices, for example, permanent secretaries and political appointed officers are required to take the oath as well. And since October 18th last year, we also conduct a oath-taking ceremony under the witness of the chief executive, department chiefs, and also those and all senior officials have took the oath, and requiring to sign the declaration, the oath, and also to swear allegiance to the HKSA government also manifested the conditions and responsibility of the patriots. Under such mechanism and criteria, and also the importance of civil service in our political system, that itself is quite clear. On the recruitment and the promotion and the training and aspect of the civil service, we shall make continuous improvements and move in with the times. The civil service, which included the political appointed team, have all along a listening or humble listening to the public views and accept criticism so as to improve our work and providing better service to the public for building a better Hong Kong. On the discussion, I hope that it should be based on facts in trying to come with recommendations to help the implementations of these new measures, which I see positive to Hong Kong's development. Thank you. That's the end of today's press briefing. Thank you.